Hello. Good morning, good evening, good afternoon. Welcome to this latest Maternity Natural Health webinar. I'm hosted by IMCO, the International Integrated Maternity Healthcare Organisation. I'm Kathy Frey and welcome along, and I'm very pleased today to have back the wonderful Julia Bartrop. Julia, Dr. Julia Bartrop, give us a good wave.
Hi.
Say hello. And Julia has spoken before, and we've just had to get her back because you're going to discover, if you haven't listened to Julia before, you're going to discover that she is this amazing reservoir of information. And I know that she's got a really great PowerPoint presentation that she's going to go through with you guys today. This is part one of a two-part session that is specifically focusing on acupuncture and the first trimester, and there's just so much to tell you. For those of you who don't know, Julia is also one of my right-hand mans at IMCO, and just the most amazing lady who is part of the team behind the scenes. So thank you, Julia.
You're welcome. It's lovely to be back.
Yeah, it's just fantastic to have you back. This is going to be a very practical session, so just wonderful for passing on, for birth practitioners to be passing on to their newly pregnant clients. So just a little bit of housekeeping, a reminder that that we'd love to know whereabouts in the world you are and what your role is, or maybe you're a mum who's expecting, and you can just click into the chat area and let us know that. And also, if you have any questions for Julia, just go into the Q&A button, usually at the bottom of your screen, and type in your questions, and I'll make sure that any and all questions are answered before we wind up today. The sort of outline today is that very shortly Julia is going to take over the screen, and she's going to present to you for the next sort of half an hour or so, and then we'll wind up and do some discussions at the end. So that's what it's all about today. But just a little overview about Julia, who haven't met her before. She's a mum and two, and she's an acupuncturist, and she's a Chinese herbal medical practitioner. And her main areas of specialty are preconception and fertility, pregnancy, birth preparation, and of course postnatal care. I'll get her to give you a bit of an overview about her background as well. So big welcome, Julia.
Hi everyone. Okay, so just bear with me as I share my screen. I'm going to go to share screen. Okay, good morning everyone. It's such a wonderful thing to be back and teaching again. So this is part one. I'm going to do an overview today just on nausea and vomiting, on fatigue and exhaustion, and also on bleeding in pregnancy, threatened miscarriage. So there's lots that we can do in the first trimester, and there's lots to get through, which is why we're going to do part one. So I am an acupuncturist and Chinese herbal medicine practitioner. I also have 16 years of experience in pathology as well. So I combine a lot of Western medicine with Eastern medicine, and this is actually my specialty. So let's get started. I've got a lot to get through. I have tried to simplify it down, so I am looking forward to questions at the end, and you can always email me afterwards if you've got any questions as well. So let's dive in. Okay. So TCM has been around a long time, like 5,000 years. We'll say for 3,000 years, TCM has actually promoted specialized treatment for women in pregnancy and postnatal care. So going back to when TCM was first established, it was women treating women. The men wouldn't actually take part in treating the women throughout pregnancy and postnatal care. It was all done by women. So the other thing is that using acupuncture during pregnancy is now becoming more and more well known in the Western world, and the fact that we have so many tools that can help with so many issues that occur in the first trimester. We want to get it out there that women don't have to suffer through their pregnancies. They don't have to put up with nausea. They don't have to put up with vomiting. They don't have to put up with being tired or having back pain. There are ways that we can assist them. It's really safe, it's really effective to have acupuncture all the way through your pregnancy. And that also TCM provides a window of opportunity to enhance a woman's well-being. So there are 3 stages of life where acupuncture and Chinese herbal medicine can actually reinvigorate, revitalize, and completely change a woman's health. And this is during pregnancy, postnatal care, and at the stage of menopause. So for all women, regardless of what they're going through, during the first trimester, I will see them once a week for the first 14 weeks of their pregnancy until their pregnancy is established. And then once we get into the second trimester, it's generally every 4 weeks. So once a week for 14 weeks can change depending on how severe their symptoms are. If they're going along and everything's really well, it's just once a week. But if things crop up, we may need to get them in twice a week, and then also support them with Chinese herbal medicine and other moxibustion and diet and lifestyle issues advice as well. So Chinese medicine is a preventive medicine. So it's viewed as preventative medicine, and it promotes preventative care. So the idea is that throughout the whole entire pregnancy, we are strengthening the mother and the baby. We're reinvigorating, we're reinforcing the health of the mother and the baby. We will treat problems as they occur, but the main aim is that if we have a healthy female coming in the first stage of her pregnancy with no issues, we want that to stay throughout the whole entire pregnancy. So as well as using acupuncture, we can also use cupping. We can use moxibustion, which is a herb, which is warming, and we put warmth over a point. So we can roll that moxa up and put it on the skin and burn it. It doesn't burn the skin, it'll get down to a third, and then we'll take it off. So what we're doing is we're actually putting warmth into the body and over that acupuncture point to reinforce the flow of blood and reinforce the flow of oxygen and bring warmth into that area. So this is especially useful if the female has a cold back or a cold stomach. That can actually make nausea a lot worse and cause more back pain, more aches and pains, abdominal pain. So this is actually a form of treatment that we use to help to reduce that pain and to bring warmth into the body to actually help that woman get over the aches and pains and to make her feel a lot better. So by warming the area, we're actually bringing blood flow to the area, we're bringing oxygen to the area, we're relaxing those muscles as well, and that is what helps to ease the pain in the area. So again, we're going to see the client once a week until she's 14 weeks pregnant and until that pregnancy is actually established. So what can we assist with? Now, this is just some of the things that we can assist with. Nausea and morning sickness we're actually well known for now. A lot of people don't realize that we can actually help with fatigue, with anemia, with threatened miscarriage, with anxiety, headaches, aches and pains. Insomnia is one that people really don't understand that we can help with, but it's really, really effective. Reflux, heartburn, and constipation. So a lot of women get constipated in the first trimester of pregnancy, and people think that it's actually due to the hormones because all the blood and all the hormones are working down in the uterus to establish the baby and also to grow the placenta. So diet and lifestyle advice. So this is used alongside the acupuncture and the Chinese herbal medicine. Diet and lifestyle advice in pregnancy forms over 70% of our actual treatment. So we use this to actually reinforce treatment, to assist to nourish the mum and the baby. And diet and lifestyle advice includes food as medicine. So we'll be saying, right, for this condition, these foods are are not good. So if someone's got cold in the body, we don't want them eating cold food from the fridge. We don't want them having cold drinks. We don't want them having herbal teas which are cooling. So we wouldn't prescribe peppermint tea for them because it's too cooling. We wouldn't be getting them to have green tea, or we wouldn't be getting them to go outside in a t-shirt and shorts in freezing winter because it's too cold for them. So exercise. So this is really interesting. So a lot of the Western medicine says exercise as you have been prior to pregnancy. However, that can be too much for a lot of women, and it's we go with how the woman is feeling. So if someone's been running and they've been a runner their whole entire life and they're full of energy, they're full of vitality, then we'll say run up until about 14 weeks, but don't go for a 40-minute run, cut it back to a 20-minute run. So a lot of women don't necessarily like that though. With other women, we're like, okay, you need to go to gentle stretching, or you need to go to yin yoga or Tai Chi, and focus on breathing, which is actually going to help you, and just gentle walking. So walking is actually one of the best forms of exercise that you can do in pregnancy. It's weight bearing. It's going to help with making sure that your bone strength is there. It's cardiovascular. It gets all of the blood flow, all of the oxygen going. You're burning calories. You're actually getting fit at the same time. And it helps with blood sugar levels as well. And it's really important for those that develop gestational diabetes. It's a really, really good form of exercise. So some women who are older can develop gestational diabetes in the first trimester of pregnancy. So again, I would be giving them walking or swimming as a form of exercise. And then further down the track in second trimester pregnancy, when you do the glucose tolerance test, for those that test positive, again, I reinforce walking. So general advice. So we'd be advising them to avoid certain foods, to stop doing certain activities, to rest, to encourage different foods, so more warming foods, more soups. And that will help to establish the pregnancy, and also to give the woman and her developing baby lots of vitamins and minerals. And the one that I really want to reiterate is rest. Rest is so essential in the first trimester. And a lot of women in Western society are running around doing a lot. They're pregnant, they're fatigued, they've got nausea, they've got vomiting, and they're just trying to hold it all together. So I want to reiterate, the most important thing in the first trimester is rest. And this is something that here in Western society, we don't adhere to. So nausea and vomiting. So nausea and vomiting is extremely common in pregnancy. And from my clinical experience, I find that it's most common in women that have low BBT temperatures, so a temperature less than 35.9 from their BBT charting. These women tend to have a higher instance of nausea and vomiting. So this is actually because their body basal temperature is actually all over cold, and cold actually affects the flow of the digestive system and the flow of how the digestive system actually works. So what we actually do is when they come in, we will be treating them all individually. So everyone with acupuncture and Chinese medicine is treated individually for what is going on for them. However, there are actually 3 points that we may use with every woman who comes in with nausea and vomiting. So these, we use these points in the treatment. So they're called kidney 27, which is just here. It's just here, and I'll get them to rub that, and we'll put the little tacks on. And then kidney 6, which is just on the inside of the bottom of the ankle. So a lot of women, when I put kidney 27 on, will actually say, oh, my nausea is actually stopping. And then kidney 6, when I put in combination with kidney 6, they say, oh my God, the vomiting, I don't feel like vomiting anymore. So the nausea and vomiting can be eased. So I will actually apply these to all of my clients so that they can, throughout the whole entire week, just press these points as needed. So that's what we do with the press tacks. And then they can press it as much as they need throughout the day. I generally say 3 times a day, but if the nausea and the vomiting is getting really, really bad, they can press it as needed, and they've got that for the rest of the week. So we can also use a point which is called PC6. So some of you might have heard it as the morning sickness point, and we can actually apply C bands to this one. I'll bring it up in a couple of slides. So with nausea and vomiting, we generally find that there are 3 teas that will assist with the nausea. So I always get my girls to try the peppermint tea, ginger tea, or chamomile tea. If they have a lot of cold, so they're one of the clients that has had a BBT of less than 35.9, I won't get them to take the peppermint tea because it's too cooling from a Chinese medicine point of view. So we'll focus more on the ginger tea and the chamomile tea. And then we'll also use herbs, which will assist with reducing the nausea and the vomiting. And this just helps to promote digestion. And by getting that digestion working and using the tax in combination, we're getting more nutrients into the body to help with that and establishing a pregnancy. Okay, so kidney 27, as I said, is right here. To find it, basically, you're going to go from the midpoint of the sternum to the shoulder, halfway again, and it's literally under the collarbone. Or if you bring your hand up, so you want your thumb and your middle finger, just bring it under the collarbone and it will literally be right there. So we're going to work in a clockwise direction, or with the tax, they just apply the pressure. So they can apply the pressure for 1 to 3 minutes, depending on how much it's needed, until that nausea starts to go. So if there's nausea and vomiting, I do suggest doing kidney 27 at the top and then trying kidney 6 at the bottom. It depends. Every woman works differently. So I say go to the point that works best for you and then go to the other one. So kidney 6, as you can see, is down the bottom of the inside of the foot, just underneath the ankle bone. You'll find a little dip when you're doing this, and when you press, the woman will feel that nausea and vomiting is easing. And you do these 2 in combination, and again, holding it for 1 to 3 minutes, depending on how long it takes for the nausea and vomiting feeling to subside. So I'm going to go on to pericardium 6 now. So a lot of people have developed more seasickness bands. So you'll see a lot of women on their wrist, exactly where my watch band is, that's where PC6 is. And you've got the seasickness band. So PC6 can be used in pregnancy, but also for anyone that feels nauseous on planes or trains or boats as well. This is actually a really good point. In pregnant women, I find that PC6 can actually make the nausea and vomiting a little bit worse. So I tend to go with kidney 27 and kidney 6 first. And then if it's not subsiding, we'll add in pericardium 6. I teach everyone how to use these points, how to find the points, so that they have all of the points in their back pocket to bring out for when the nausea and the vomiting actually gets really bad, and we're going to be seeing them weekly. So again, pericardium 6. So this is found on the inside of the wrist. You can see where I've got this dot. So you should have 2 tendons that come through here. If you use your 3 fingers, you place it from the fold here, just under the wrist. You're going to place your 3 fingers here, and you can see it's just under my wristband. And there's the point in there in between the 2 tendons. So again, this can be used with seasickness bands. You can put magnets on it. I don't put the tax on here because it can get really irritated. So I just teach people how to actually find the point and apply acupressure to this point. So again, you're only going to be holding it for 1 minute to 3 minutes until that eases, until the nausea and the vomiting eases. So diet and lifestyle advice. So one is for people that have really bad nausea and really bad vomiting, we want to prevent dehydration. So we want to keep them out of hospital. We want to have to keep them out of hospital so that they don't have to go in and be pumped full of fluids. So one of the best bits of advice is sip on water. You want to regularly make sure that you're sipping on water to avoid dehydration, and we do recommend electrolytes, so hydrolyte, gastrolyte. You can sip on that throughout the day. That's going to provide you with your potassium, your magnesium, a little bit of sugar, and your sodium and chloride as well, which is all your electrolytes, which is going to help to keep you hydrated. So the other form of medicine that we provide for nausea and vomiting is to sip on soups. So chicken broth soup, potato soup and vegetable broth soup. So it's a clear fluid, but especially with the chicken broth, you've actually boiled the bones. So you're getting that bone marrow nourishment in your clear broth, and sipping on that is going to give you essential vitamins and minerals. So again, the herbal teas, the ginger tea, we don't like to exceed more than 3 ginger teas a day, which is also why I bring in the chamomile tea as well. So chamomile is a sedative, it's calming, it helps to calm the digestive system, and it helps to calm anxiety at the same time. So for the other thing that we recommend is small snacks. So don't worry about breakfast, lunch and dinner, just trying to have 6 small snacks a day. Focusing on slow releasing carbs. So here we're going to be looking at your bread, your pasta, your rice, congee soups if you can. Otherwise, any slow releasing form. And for nausea and vomiting, we do find that those slow releasing white carbs are actually really good. During the first trimester, I reiterate to people, don't focus so much on your diet, especially if they're suffering from severe nausea and vomiting. We just want you to be eating and making sure that you're drinking, and we can focus on your diet and picking up all the vitamins and nutrients in your second and third trimester. So baked potato is actually a really good one as well. And then I suggest like a protein at night. So some nuts, a protein bar, some yogurt, and then rest. Because if you're not getting enough energy, you're actually, all of your energy is actually going to your uterus and to forming that pregnancy and also developing a placenta. So rest is really, really important, and it's okay to go to bed early. It's okay to rest, and please listen to your body, which we find a lot of women don't actually do in the first trimester. So fatigue and exhaustion. So this comes on from nausea and vomiting. And again, you're going to hear me say rest. So a lot of women are really, really surprised when they're finding that they are so tired during the first trimester. So, and this bone tiredness can actually take women quite by surprise. They can't work out why they're so tired. And it can be really severe and debilitating. So a lot of women think, oh, I'm just pregnant, there's nothing wrong with me. However, what they don't realize is that so much energy is going down into that uterus, and they are doing a lot of work, although it can't be seen, because we're actually making another organ. We're actually making a placenta. So we make a whole other organ, which is going to actually provide all the nutrients and all the oxygen for our baby for the rest of the pregnancy. So as well as making the placenta, we're also making a baby. So we're focusing on 2 very, very important things. And although you can't see it, this is actually what the body is doing. So along with that, we actually have a whole impact of hormones going on. So estrogen actually increases to a rate of what we'd normally have with 150 years of menstruating in the first trimester of pregnancy. So you've got hormones going on, you've got, the embryo implanting and growing, we're growing a placenta. There's a lot going on, and people don't actually realize that. So it's like when I sit down and talk with them and I say, hey, you're actually growing another organ, plus you're growing a baby, and this is why you're tired, and you're using a huge amount of energy. And they look at me and they're going, ah, okay, that explains it. So in Western society, women still keep going on. They still keep working 8 hours a day. They're still running households. They're still running after children. They don't slow down. And the main thing is, when you are feeling really, really tired, you need to stop. If you're feeling really tired at 6 o'clock, it's okay to go to bed. And this is what I reinforce with all of my clients. It's okay to feel tired. If you're feeling tired at 6 p.m. and you can't get up, go to bed and sleep. That's the best thing you can do. The other thing is, even during the day, is stop, put your feet up, have a cup of tea, have something to eat. Don't be flicking through your phone. Don't be watching TV. Just sit down and rest. Or even just going for a gentle walk, not a really vigorous walk, but a gentle walk, which will get the energy going, the blood flowing, and that can help to give you a little bit of energy as well when we are feeling so tired and exhausted. So it's, as I've said, it's really important for women to listen to their bodies if they are feeling tired, just to slow down. It doesn't necessarily mean that you have to be on bed rest. It just means please slow down, get adequate rest. So like I said, if you need to go to sleep at 6 o'clock at night, go to sleep at 6 o'clock at night. If you need your husband to step up to look after the kids and cook the dinner at night because you can't, please get him to do that. If you've got grandparents or friends that can take the kids for an hour so you can just have a cat nap or just sit down and rest, do that. If you can ask for help, if people can make you meals, that would be really, really good. So nourishing and warming foods. So we're going to go to miso soup. We're going to go to our chicken broth soups, our casseroles, our stir fries. Many women, including myself, actually crave carbohydrates and cheese. So it's that fat and that carbohydrate. Which is really, really good. And I found this was really good for my energy levels as well. You want to be making sure that you're taking a really good multivitamin, preferably from a practitioner, because a lot of them are smashed together with little bits of minerals and vitamins. And they also have a lot of fillers in them. So you also need to be careful of the folic acid. So a lot of women at the moment have issues with methylation. So this is why folinic acid is actually recommended now. And you can get that actually naturally from your green leafy vegetables. So from your spinach, your bok choy, your cauliflower, your broccoli, that's a natural source of folinic acid, so as well. The other thing that we want to do is rule out anemia. So over the last year with COVID, I've been noticing a lot more people coming in being vitamin D deficient and anemic, and they're developing anemia within that first 7 weeks of pregnancy. So that means that they're going to need to make sure that they're taking correct iron levels, and iron is increased in pregnancy. Our demand is actually increased in pregnancy, and by actually making sure that they're getting enough iron, we're ruling out the need for a blood transfusion and blood loss at the end of the pregnancy. You want to focus on having small meals as well. Having a huge meal puts a lot of pressure on the digestive system. Eating smaller meals means that it's able to digest the food a lot easier and then release the energy in little bits over the day. It'll also help with your energy. So you're not going to have that, I've got energy, and then have a major slump. So we also recommend just having a handful of nuts, around 3 to 4, when people start craving chocolate, as that will help to keep your blood sugar level more stable. So diet and lifestyle, as we mentioned, food is medicine. You want to be having your chicken broths, your vegetable broths, your miso soup, your cheese toasty sandwiches are actually really, really good. Lots of people crave them. Warm teas, so not too much caffeine, but focusing on like your ginger tea or a chamomile tea, a herbal tea, which can help. Even just warm water, lemon in warm water, you can sip on that. I did that a lot through my first pregnancy. Again, resting and slowing down. So herbs, I will give my clients herbs to help with energy, and it's focusing on building up their blood and focusing on building up their digestion as well. And by working on the digestion, we're getting more energy and all of those vitamins and minerals out of our food, which provides us with more energy throughout the day. So again, weekly acupuncture. If they're severely exhausted, we're going to get them in twice a week, and I'm going to be checking their asking for blood tests, making sure they're not anemic, making sure that vitamin D is all good, because vitamin D is really essential in the first trimester of pregnancy and throughout the whole pregnancy. It can affect mood. We need it for bone health, and we need it for hormone production as well. And then we will continue treating the fatigue all the way through the pregnancy as well, especially if they're really fatigued in the first trimester. It's going to be something that I'll be focusing on as I see them throughout their whole entire pregnancy. Okay, bleeding in pregnancy. So this is really important, because a lot of Western medicine is like, oh, you're bleeding in pregnancy, or you may be having a miscarriage, we'll just wait and see. This is where acupuncture can actually step in and really help women and provide a source of support and help women to feel like they're doing everything that they can. So approximately 50% of women bleed during pregnancy. This bleeding doesn't necessarily mean that they're having a miscarriage. There can be other reasons for the bleeding. We generally get implantation bleeding, and we can bleed around the time of when our period was due. That's all normal. That's not actually meaning that you're having a miscarriage. So acupuncture may actually be able to assist with bleeding if they are having that frank red blood. We can actually use points that help to decrease the blood flow and may actually stop the bleeding. We use this in combination with herbal medicine though, and with moxa and diet and lifestyle. So you want to make sure that she's staying warm. You want to make sure that she's not expending too much energy. And you want to be getting her to be checked as well with ultrasound so that we can see the fetal sac and the fetal heartbeat as well. So acupuncture can actually aid with the threatened miscarriage as well. And what acupuncture does is it helps to relax the female. It helps to relax the body. We get the serotonin, the feel-good hormones going. We put the points in to help calm down anxiety and fear. And by allowing the woman just to calm herself down, this can actually impact the bleeding as well, because stress can actually cause bleeding to increase or to keep going. So acupuncture can actually help the woman feel like she's doing everything she can to maintain her pregnancy and that she's protecting her baby. Whereas a lot of women will actually go to the hospital and they'll say, look, you're bleeding, you may have a miscarriage, we'll just have to wait and see. So that wait and see actually increases anxiety, increases fear, increases a woman going round and round with what if I do that, what if I don't do that, what if I lose the baby. And this actually impacts her a lot. So acupuncture can actually really help in that way, that they can come in, they can feel like they're doing something to help, We're calming her down. We're providing emotional and physical support for her. And just, we want to reiterate that all bleeding in pregnancy must be looked into. So if they ring me up and they say they're bleeding, I will do a treatment, but I'll also get them to go to the hospital. So I reinforce that you're bleeding and we want to make sure that everything's okay. So we'll do the treatment, but please go to the hospital. The threatened miscarriage. So signs and symptoms of a threatened miscarriage is that there are warning symptoms pregnant. So we'll have vaginal bleeding, we may have lower back pain or abdominal pain. With a threatened miscarriage though, the cervix is closed. You can see a fetal sac and we want to make sure that we can still hear a heartbeat. So if all of that's there, then it's more of a threatened miscarriage rather than that the woman is going to lose her baby. So with a threatened miscarriage, again, we can use 2 points, which will help to reinforce that holding in the body. So we actually use the top of the head, which is do 20. And what that does is that brings energy up. So if in case the body is going to expel a pregnancy, the energy will go down. So by bringing that force up, it's reinforcing that we're reinforcing that energy up, and I'll get the woman to be doing this throughout the in-between treatments as well. So kidney 9 is on the inside of the leg, and this actually goes straight to the uterus. So we use this a lot to what we call calm the uterus down. So in threatened miscarriage, or what they call a restless fetus in Chinese medicine, this point is always used. It goes directly into the uterus, but it also is a calming point for females. So it helps to calm the mind, it helps to calm them emotionally. And then we can use the bottom of the foot as well to really ground the female in. So these are the go-to points for a threatened miscarriage. I just want to reiterate though that TCM cannot prevent a miscarriage from occurring, but we can help to calm and reduce anxiety in pregnant clients if it's looking like they may have a miscarriage. So generally with a threatened miscarriage, we'll get them to come in twice a week, and I'll get them to do the points in between an appointment as well. If they're really, really anxious, really, really fearful, I may get them in 3 times a week, or we may just do a quick telehealth phone call just to check in and see how they're going. So kidney 9 and do 20 are points to assist with bleeding. We also have other points on the toe, which we can use, but the main factor that we're going to do is to prevent a miscarriage from happening is these 2 points. But the calming and reducing anxiety and fear is also a huge factor in this treatment as well. So these are the points for threatened miscarriage. So you can see at the top of the head, so you're going to come from the ears and just up the top, and you're actually just going to rub that. And then the kidney 9 is on the inside of the inner leg. So you're going to do 4 fingers and then 2 fingers. And basically you're going to come up from halfway between the back of the ankle and the ankle itself, come halfway, and then you're going to put those finger breaths up and then press in. So this one calms the mind, calms the uterus, reduces fear, and it works through the uterus as well. So this is the point that we use to try and help to assist to stop the bleeding. And we use these points together, and I send my clients away with tacks in so that they can do this, or I just teach them how to find do 20. So with a threatened miscarriage, we really want to reiterate that they need to rest. It's not always necessarily bed rest, but the fact to slow down, decrease your work hours, decrease the time on your feet, reduce exercise. So for exercise with a threatened miscarriage, I'm like, you can do a bit of stretching, you can do some gentle walking, but we want to keep it to 5 minutes per time. Decreasing stress is a huge one. You want to be able to just make sure that, yeah, during this time, you've got some quiet time to yourself. So if you can, ask grandparents for help, ask friends for help, put kids in daycare. And if you're working from home, some of my clients found this really useful because they were able to actually do half an hour of work, take 10 minutes to sit down and just rest, and then, you know, go back and do 20 minutes of work, and then they'd take another 10 minutes of rest, or they'd have a nap during the day as well. You want to make sure that you keep your feet covered and warm. This is because our vitality is actually in the bottom of our feet where our kidneys are, and this actually keeps our body temperature nice and warm, and keep them covered and warm. So I always say you need to be wearing socks and you need to be wearing slippers, and this is where moxa will come in. So we'll moxa the bottom of the feet as well to put warmth into the whole entire body as well. So as soon as they know that there may be a threatened miscarriage, we want to get them in for acupuncture as soon as possible. So if any of my women running up and they're bleeding, I'll get them in for a treatment, and then I'll send them to the hospital. So we also have a herbal formula which is called Hold the Fetus, and I use this on the females until they're 14 weeks pregnant, or they may, if they've had numerous miscarriages before, we may actually use it throughout their whole entire pregnancy as well. So this formula is a classic Chinese herbal medicine formula, and it's got herbs in there which actually help to calm what they call the restless fetus. And it's got warming herbs in there which help to warm the uterus as well, which is where the moxibustion in the bottom of the feet comes through as well. We want to make sure that she's warm as well. So she's dressing up. So she's wearing a singlet, she's wearing a top, she's wearing jeans, that her lower back is not exposed to any cold, and that her stomach area is not exposed to any cold. I'll also get them to do moxa at home every second day, and that just reinforces that warming and that nurturing and nourishing as well for the female. So just to reiterate, acupuncture cannot prevent a miscarriage from occurring. We use acupuncture to support the woman and her body, and we use acupuncture to assist the woman to relax, to release stress, anxiety, and tension. So I did have a client not so long ago. She did have bleeding. She had bleeding basically from the start of her pregnancy. As soon as she found out that she was pregnant, she was in and out of hospital with the bleeding, in and out of having scans. She rang me. We hadn't done any treatment since she'd found out she was pregnant. I was trying to get her in, and she just couldn't come in. And then she finally called me, and we did a treatment, and she left feeling really relaxed and really calm. And she rang me the next day to thank me because overnight she'd actually had a miscarriage, but the fact that she was a lot more relaxed, less stressed, and more calm, the miscarriage actually happened a lot easier, a lot quicker. And she rang me up to actually thank me, to say thank you for putting me in that state, because it actually enabled my body just to do what it needed to do. So although it's incredibly sad, this is how we can actually help with acupuncture as well. So if the body needs to actually release a pregnancy, and if the woman is in a calm and relaxed state, it will happen a lot easier, and it can be a lot more emotionally easier on the female, although having a miscarriage is absolutely devastating. But this is one of the ways that we can help and we can assist our clients as well. So as I said, sometimes here, promoting a state of calm and releasing stress aids the body to either hold a pregnancy or to release a pregnancy. And that client in particular now is actually 10 weeks pregnant with her baby now, and we have been doing acupuncture throughout that whole entire pregnancy, and she just says that she feels much better. And having a miscarriage previously, a lot of the clients are very anxious and very fearful, especially until they get to that 14 weeks. So throughout that first trimester with those clients, we are always trying to promote we were always trying to calm them down. We're always trying to calm the anxiety down and to release fear. And we really provide emotional, mental, and physical support for these clients as well. So just to summarize, acupuncture is safe and effective in all stages of pregnancy and postnatally as well. We focus on improving the mother and the baby's health. Acupuncture and Chinese herbal medicine is a preventative medicine form. It's beneficial to improve overall health, wellness, and emotions. We can't prevent a miscarriage from happening, but we can assist with threatened miscarriage or bleeding in pregnancy. And diet and lifestyle advice is a huge part of our treatment in Chinese medicine. So that's just me. If you'd like to contact me, my website details are up there, and I specialise in women's health, fertility, pregnancy, and postnatal care. So yeah, that's it for today. So I look forward to answering any questions, if there are any.
Oh, Julia, it's so great. I for those of you watching live or watching later, I warned you, she's so fantastically got so much information. It's just brilliant. You know, I find myself taking a whole lot of notes. Some of the points that you've gone over, I might just throw a few questions in there myself. And now you talked about the basal body temperature, and for those that's not everybody's familiar with that term, versus what a normal temperature is, body temperature. And basically your basal temperature is your lowest temperature when you're at rest, right? So sort of say your temperature when you wake up in the day before you start doing some exercise. And that's a really interesting thing to just a little reminder, I guess, that, you know, when as health professionals we are taking temperatures, it is kind of makes a whole lot of sense to be taking it at that rest level. Have you got any commentary on that?
So basically, if women are taking their BBT, the main rule is before they even get out of bed, they should have a thermometer there, and then just basically reach over, put it in, take their temperature, and then get up and go about the day. So I've tried to keep it really simple, because if a temperature is less than 35.9, we want the minimum basal body temperature to be about 35.9 to 36.4 for the first stage of their cycle. And then once they've ovulated, it's going to be a little bit higher. So this is where a lot of our diagnostic techniques come into Chinese medicine as well, because if they're on the low side, so 35.9 and below, then a lot of our treatment is actually working on building up their warmth or their yang energy, which is where the moxibustion comes in, which is where we're saying we don't want you eating cold food out of the fridge, etc. You need to keep your feet warm. And we'll be giving them warming herbs. And this is where ginger and garlic come in as natural food as medicine herbs, but also as herbs which boost our immune system up. So this is where our system of treatment, it's not just one, it's looking holistically at the whole body. And for those women, I have noticed, as soon as I notice that one of my clients has a really low BBT, it's always like, let's put warmth in, because I'm looking further down the track, because I don't want her to have that nausea and vomiting in that first trimester of pregnancy. So when they're coming in, I'm already trying to prevent things from happening once they're pregnant. So
yeah, it's so interesting. You know, when you look at a general booking new client sort of appointment, temperature is not something that is generally taken. I mean, we'll a baseline blood pressure is taken, obviously, a baseline weight, what's their pre-pregnancy or, early pregnancy weight, their height. But we don't ever think about temperature, not very, very much in Western medicine. That's really, it only comes into play when the woman is unwell. So just an interesting reminder there. I really liked, I adored, loved your whole emphasis on the rest. We just can't emphasize this enough. It is absolutely I think probably the biggest contribution to general first trimester issues, actually whole pregnancy issues, really, is a lack of rest. And when you are in that early pregnancy, your body is bombarded by progesterone, which it is supposed to be, and you are supposed to be feeling tired. And I often compare it that when you are unwell, let's say you've got a cold or influenza, if you're sick, you don't have energy. You want to lie down and do nothing because your body wants you to do nothing so it can get on with doing its job of healing you. And it's exactly the same thing when you're growing a placenta and growing a baby. You're growing these new organs, as you say, and your body wants you to rest so that it can get on with doing what it wants to do, and that is focus on keeping and growing that pregnancy. And we are terrible in the West at women feeling like they should be able to push through it. And it's just not okay. It's just not okay. And I also love the fact that you sort of make that comment that acupuncture does not necessarily stop a miscarriage. What it does is it supports the body to either assist it to complete that miscarriage or assist it to go on with the pregnancy. And the fact that the woman has done something about her spotting or bleeding and she's been proactive does absolutely put her in that place of feeling like she's done her best that she could for that potential pregnancy. And I think it's that powerlessness that women feel where they've got spotting, and what do they do and what can they do, and the mother guilt comes in there, and it just the fact that you've been proactive. Can we talk about, I might just throw in there from a midwife perspective with regards to spotting and bleeding in pregnancy. When a woman is having that a little bit of spotting, then absolutely rest is the most important thing. But I would sort of, because spotting is so common, and because there's really not a lot that an emergency department can do for a very early pregnancy, then what I would say is just stay at home and contact your acupuncturist. Your traditional practitioner, whoever that might be, or different modalities around the place. Certainly if a woman is having severe pain or heavy bleeding, she absolutely needs to go to the emergency department, because she may need morphine or some strong pain relief for that severe pain, and she may need a blood transfusion for the blood loss. So that needs to be assessed. However, if she's only having little bits of spotting, then I would say to a woman, don't send yourself off to the emergency department when you're 10 weeks pregnant because you've got spotting. What can they do? There's nothing practically that they can do for you. They can't do an emergency cesarean and quickly deliver your baby. So if you're not in severe pain and you're not having terrible hemorrhaging, terrible bleeding, then the best thing you can do is rest. And get to have an ultrasound at the next convenient moment. But that is a better thing for you to do, I think, than to be, you know, dashing to the emergency department at 3 o'clock in the morning. They see you as a emergency kind of client, and you're sitting there in that cold waiting room, sitting on a chair, unable to rest, you know, potentially for hours until they see you. So it's just that little balance, really. So it is important to be assessed, but it doesn't necessarily always need to be that emergency department level. But severe bleeding and severe pain, absolutely to the emergency department. Does that kind of make that makes sense, doesn't it? Kind of.
Yeah, that makes sense. And the other thing is, like, if women will ring me up and they say I'm bleeding, and I will ask, you know, is it red blood? Is it brown blood? Because quite often as the uterus grows, it can push out old blood, which is where that distinction of the red blood and the brown blood comes in. So if they're saying, oh, it's brown blood, it's like, well, I'm going to be less concerned because I know it's more old blood and the uterus is just growing and pushing it out. Whereas if they're having the constant red frank blood, that's when I'm starting to have alarm bells going, and I will be asking them, do you have back pain? Do you have abdominal cramping? You know, what's going on? Because that is obviously a first sign of an impeding threatened miscarriage to miscarriage as well.
Absolutely. So when you were saying, you know, when you make that comment that when you'll see the woman before you send them off, because you know if they go to see a medical professional, they could be there hours.
Yeah.
Whereas if you see them for a few minutes before they go, then you can be, their body can already be, you know, starting to heal. Yeah. So absolutely.
Exactly.
But without taking it to the extreme of saying that, you know, she's hemorrhaging away and you make her stop at your place. That is not what you're saying.
No,
in case somebody
if someone
it like that. That is not what we say.
Not what I'm saying. I'll triage them on the phone if they're ringing me up, and if it's severe heavy bleeding, the first place I send them is the emergency. So, and then if they're in emergency and they're waiting,
we'll just underline that before somebody messages us on that one.
And I have time, I may even go into the hospital while they're sitting there in the waiting room to do to go in and do some acupressure or some acupuncture.
You are a godsend. Actually, somebody's asked whereabouts you based, and Julia is based in Melbourne.
I'm here in Melbourne, in Australia. So yeah, and I work in Eltham. So yeah.
We've got a comment in here that one particular birth practitioner, Petra, has made the comment that most of the women she's working with could never afford acupuncture each week, you know, for 14 weeks. So what would you suggest as an alternative treatment schedule? And I guess, well, you know, a good start would be sharing this video with those clients so they can actually be helping themselves. But what else would your comment be on that?
Definitely. So one thing that I'd really like to do is actually establish online training, especially for those women that can't afford it. So I'd like to do a series of videos where I can actually have someone film me and actually show women the points that they can be doing throughout pregnancy as well. I know that Dr. Deborah Betts in New Zealand actually runs a community clinic. So I think they pay $20 per appointment, and she actually deals with pregnancy issues as well. And I think she runs that on a Tuesday and a Thursday. There are other acupuncturists.
Yeah, and for those of you who haven't heard of Deborah Betts, she would be, she's absolutely a world leading specialist in maternity acupuncture. So that's Deborah, D-E-B-R-A, and then Betts, B-E-T-T-S.
Yeah. So other practitioners will run what we call community acupuncture. With COVID, we haven't necessarily been able to do that, but that is a cheaper form of acupuncture. So because we do it in a communal area, so that's generally a reduced amount because you haven't got the one-on-one time or the one-on-one room. The other thing is student clinics are always an option if people can't afford acupuncture, because we're always needing people to learn on. Just be aware that with student clinics, they are being looked after by their mentors, and the mentor may need to come in given that situation that she is newly pregnant, just to supervise and make sure that they're doing everything accordingly. But that would actually be really, really good, because if you can get that level of assisting women in their really early pregnancy, it's going to enhance their practitioner skills for when they're actually graduate as well. The other thing is,
and that's a really good point, is track down your local acupuncture school, so you can volunteer as a client, and then you get the bonus that you've got the student, but also you've got that senior person supervising them. Sometimes those sort of treatments can take a little bit longer, because you know, the mentor and the student are discussing what's going on, but I mean, you're getting the best of the best, so fantastic idea.
So the other thing is, they might need to come in every second week, and in between I will give them homework, send them home with a moxa stick, send them home with the herbs, reinforce the diet and lifestyle. If the client or the female is doing all of that, then I'd be more than happy to see them every 2 weeks. I work with the individual. I work with what they can and can't afford, and we'll talk about all of that in the actual initial consult. But the idea is, I want the best for them, so I will provide the best treatment that I can give them. And I will track down other practitioners or community acupuncture, or refer them to the Chinese medicine acupuncture schools, because really we're here to help them. We want the best for them. So and
you are the best. We are going to need to wind it up, but I just love talking with you on these webinars, Julia, because you're just such an encyclopedia of knowledge in this area, and the fact that you come from that background of medical pathology as well as Eastern medicine, and it's just that beautiful blend of integrative knowledge, and which is why we love you at IMCO as well. It's so good. And I also loved one other little comment in there. I love the fact that you made that sort of reminder that rest and warmth is and lack of stress and lack of anxiety is is so important in that first trimester. And rather than getting obsessed with the nutrition, which is more of a second trimester, third trimester need in a way, I mean, when we think about it, by the time somebody has completed their first trimester, their baby is only about 2 inches long. And from the end of that 12th week through to the end of the 40th week, it's going to grow 10 times that amount. It's going to be 20 inches long and be 10 times the weight. So it is, I think sometimes women can overly focus on the nutrition and underly focus on their rest. And they have enough nutrition within their body for that first, in a way, within that first trimester, because we are talking of very small organs that are being developed, but the rest is rest. It's just so important. It makes all the difference. So it's just wonderful. And if you've got anything else that you would like to wind up on before we close this, anything else you'd like to finish with, Julia?
No, I just really want to reiterate that, acupuncture is safe and effective throughout pregnancy. And I just wish that we can get it out there so that more women actually have access to this care as well. And, it's not a last stop resort. It should be, incorporated into your general pregnancy care package. So.
Yeah, I agree. It's part of your general maintenance of wellness, not your backstop when things are going pear-shaped. Okay, well, look, we'll wind it up today because I know we're over time, but look, love you always, and thank you to everyone that's here live. It's we know a lot of people are watching it after the event, and that's absolutely wonderful, but it's great to have you guys here live as well, and we wish you a wonderful rest of your day and rest of your week, everybody. So
Bye.
bye.